Hello and welcome to the Swine Disease Reporting System. This is the report number 33. We're going to cover data on October of 2020. My name is Daniel Linhares with Iowa State.
Hello, my name is Giovanni Trevis. I'm with Iowa State.
And today we have a special guest here, Dr. Tara Donovan, Vice President of Veterinary Management with the Hanor Company. And it's really glad to have Tara here with us. Her contributions to swine population health goes much beyond the Hanor system. She have contributed much with science here in the U.S. swine industry. Is a past president of the American Association of Swine Veterinarians and the annual meeting, and she always has something going on in terms of applied research within the company with the system vets, as well as offering opportunities for a number of vet students who do projects, summer projects with the system. And most recently here, pleasure also to announce that Dr. Donovan has been nominated with the Science with Practice Award by Iowa State. So thank you for taking time to be with us today, Tara.
Thank you, Dr. Linares, and thank you as well for the award. I was just notified and very humbled. Really have, honestly, a really great team of veterinarians that I work with, and they do all of the work, I think, and they deserve accolades as well. But appreciate it very much, and really enjoy working with you and your team on a lot of the projects in the past.
It's our pleasure to be able to work with you. Look forward to keep having that opportunity going forward. So before we get started here in the PRRS page, Tara, you've also been serving as advisory member here of the Swine Disease Reporting System since the program has been established in 2017. And so a question for you is how do you use all this data from this project to influence your decisions to in turn influence swine health and welfare in the system?
Well, first off, I'm a really big fan of this report, and I think it's just great that we're finally utilizing all of the diagnostic data that swine veterinarians, do and get every day as we're collecting this data. So to use it as an industry tool is really exciting for me. We use diagnostic data in our system every day to make decisions, and the swine disease reporting system allows us to see trends in disease prevalence in the industry compared to our farms. So I spend my time looking at our farms and what our trends are, but I don't always get to see if those are matching up with the industry. And so it's very useful just to see if we're, seeing the same thing as the industry is seeing.
Benchmarking purposes.
Yeah, exactly.
All right, so getting started here in this PRRS page, Giovanni, where it reports PCR detection over time. What are the highlights that you want to bring forward from this page?
A moderate increase of PRRS virus of 4.6% was observed in October when compared with September, and this was mostly contributed by a substantial increase of 7% from 38 to 45% in wean-to-market animals. Looking this at a regional level, PRRS virus detection was above baseline levels for Minnesota, South Dakota, Iowa, Nebraska, Missouri, Illinois, and Indiana. According to the advisory group, they keep reminds us that there is a need to improve biosecurity by containing measures in growing farms. Actions like have a clear definition between clean and dirt lines, changing coveralls, boots, when crossing those lines, and planning for transportation for feed, animal, people movements are highly encouraged and give a continuous reminder for the personnel, those working the farm, on the importance to comply with loading and the unload practices are highly encouraged as well.
Thank you, Giovanni. And bringing back to Tara, and we're talking about PRRS detection here. Tara, how have you guys been monitoring PRRS in the breeding herds lately, and can you share some of your tips on the success factors to successfully eliminate the virus from breeding herds? It's a complex question.
Sure. Sure. Yeah. In our sow herds, we monitor PRRS by collecting processing fluids and farrowing. As I think most of the industry has adapted to that method for detection over the course of the last maybe 3 years or so. Depending on the status of the farm, we may collect them weekly if we are working on an elimination project or we have an active PRRS farm that we are wanting to know more on a week-to-week basis for procedures. Or on stable farms, we're doing that collection monthly and making sure that farm is stable based on those diagnostics. In addition, on the sow farm side, we do monitor the health of the gilts that are going into the sow farm, and here we use rope samples. We test specific ages of gilts every month, and we use this information to evaluate vaccine compliance and then gilt acclimation programs.
Mm-hmm. Well, thank you. Thank you for sharing that. And coming back to what Giovanni shared about on the highlights for this page, right? This year, and same thing happened the year before and the year prior to that, we now see an increase in detection rate in grow animals, right? And that usually precedes what happens in the sow farms. So, what do you take from that finding that we in an industry keep seeing that the positivity rate in grow animals precede those of sow farms, and what can we do about it? How can we prevent that per season from coming back to the sow farms?
Yeah, Daniel, we as you mentioned, you can look at the chart and see that this is a fairly consistent seasonal event that occurs. And, for us, we have mostly nurseries and finishers as opposed to wean to finish barns. And recently we focused on improving the biosecurity of our nurseries. We've enhanced our training and our early pig care and training on biosecurity. We implemented diagnostic testing using rope samples to help us understand when our nursery is infected with PRRS or PED. And we started doing disease investigations in sites where we want to identify the events that occurred around the time of that introduction to help us learn and better improve. And we're just beginning this process on the grow finish side. We've been doing it in the sow farm side, and it's helped us really focus in on areas and events. And I'm really encouraged by the information we're learning so far on the grow finish side. As an industry, an increase in wean-to-market pig PRRS puts added pressure on our biosecurity programs at the nurseries and the sow farms. We've all focused on transportation biosecurity by adding truck baking, drying systems in the sow farm. But, we haven't improved to that level in the grow finish system. And I think that's an area that we need to really look into, as Giovanni mentioned as well, and when he told us about what he's seeing in the results for this month. If the pigs in the site are positive on the grow finish side, then every transport vehicle that backs up to that site during the load out process gets contaminated. And if we don't get those transport vehicles clean, they're the carrier of the infectious agent, perhaps for the next load or going to the next site. In addition, on a site level, we have to run the site all in, all out, or they have to be adequately cleaned in between groups. Otherwise, they'll be continuously positive, and we won't break that cycle. So I think both of these areas require a substantial investment in sanitation and cleaning. And in order for us to really change that, predictable grow finish seasonality, I think we need to consider that's probably the biggest risk to our sow farms is taking it back from grow finish this time of year, where we see our sow farm incidents then increase in, January, February.
Goes back to biosecurity and measuring and then documenting progress over time, right?
Yeah, exactly.
Mm-hmm. All right, thanks for sharing that. moving forward to the next page of the report, where it shows also PCR detection of enteric coronaviruses. Giovanni, take us to the page. What are the highlights here this month?
The detection of enteric coronavirus is expected to see some increase at this time of the year, according to the predicted models. We see that deltacoronavirus has a similar detection in October when compared with September. TG, there was no detection since August, and PED, the detection was 1.2 points lower in October when compared with September. Our advisory council did remind us that after 80 years that we have PED in the United States, many U.S. farms and the whole production systems managed to eliminate this virus and successfully kept it out with biosecurity. There are some systems that still immunizing pigs on an ongoing basis, and practice from growing pigs as a biosecure transport, as Dr. Donovan mentioned, should be implemented to avoid that PD spill over back to breeding herds and restart the cycle again.
And Tara, bringing back to you this month, if we look at the positivity rate for PED, it's relatively lower compared to previous years. What does it mean? What's your take from this PED data?
Well, I hope it means that we'll see a continued decrease in sow herds as well. I think, if you have a sow herd that's positive for PED, those pigs, eventually have to wean, and so you contaminate all of the grow finish sites really going forward. And so we see in our system the summer months where we can get those sites that have been contaminated laterally to go back negative, get them cleaned up and refill them with pigs and start them off negative. We continue to have negative sow herds, but we do have, as I mentioned, some nursery and finisher sites that get infected due to lateral introduction. Mm-hmm. And as I mentioned earlier, we started to conduct disease investigations in those nurseries and to help us start to identify the risks around those introductions. And PED is a bit easier than PRRS, as you guys know, that you can, detect that disease pretty quickly and, narrow down the time of infection to, just a week or so, right, before that happens, and really focus in on what events occurred on that site during that week period. So we're just getting started at understanding some of those introductions, but it's all going back to biosecurity. And with that, I'm excited to hear about the trend that you mentioned for the industry. Maybe that will result in less lateral introductions for us and for everyone else.
Mm-hmm. And Giovanni mentioned that there was no TGE RNA detected in any of the PCR since August, right, Giovanni? And that's despite it has been tested roughly 6,000 tests since then, or?
Yes, it's about 3,000 cases per month that are tested for TG.
Well, that's a good sign, right? That biosecurity is really taking care of PED and TGE, and as Tara is talking about further working with biocontainment biosecurity, that can be achieved for hopefully PED and Delta too, right?
Absolutely.
All right, so flipping the page here for Mycoplasma hyopneumoniae and detection of its DNA by PCR. Giovanni, what's the take home for Mycoplasma?
Mycoplasma is in the highest level of detection according to the predicted year for 2020. And the Advisory Council did remind us that even though detection of Mycoplasma hyopneumoniae is falling expected, there are some endemic infected herds that are currently observing Mycoplasma hyopneumoniae associated diseases in growing animals.
So, Tara, your take on this. There are some systems that decide to keep it endemic or control, some decide to eliminate. What's your experience and advice on dealing and managing Mycoplasma hyopneumoniae in systems?
Yeah, our system is, for the most part, Mycoplasma positive, and we do concentrate on ensuring the replacement gilts. are positive going into those sow herds and are exposed as young as possible. Our experience would be we did try to do a new farm stocking with Mycoplasma negative animals, and we knew we were at risk of having some positive grow finish animals really close to those farms. So we did our best at trying to keep that contained. Unfortunately, what we saw was this time of year was when we did see some of those sow farms go back positive in the GDU. So we definitely have a seasonal outcome or prevalence of Mycoplasma. And I think if you're going to manage an elimination project, the best advice would be not to have any grow finish pigs near those sow farms, because we do know Mycoplasma does travel short distances, by the air, and just with a close proximity, I think it's pretty tough, especially this time of year. We would see this as our grow finish, acute respiratory cases. We would have this type of same outcome of this time of year. We see more Mycoplasma lesions and some of the respiratory disease associated with that mid to late finishing.
Mm-hmm. Okay. Well, thank you. And so, this is all we had for that information on monitoring pathogen detection by PCR. And now this last section of the report is the disease diagnosis report, where we share information on disease diagnosis as defined by the diagnosticians based on the tissues that were submitted, in this case here to Iowa State VDL. And so, Giovanni, what are the take-homes here from the disease diagnosis report?
The disease diagnosis presents a very good amount of agents that are diagnosed in the United States from samples that are submitted from Iowa State VDL. So to monitor those, we have an algorithm that scan this database on the background. And based on that algorithm, we saw some increased number of diagnoses for influenza A, PRRS, Streptococcus suis, rotavirus, Pasteurella multocida in the last 6 weeks. None of those was a big increase, but they were higher than expected for those weeks.
All right, and so, Tara, what's your vision on incorporating diagnostic data, production data? How to integrate all those to help decision making, to influence animal health in a kind of precision swine management manner?
Daniel, I have, a couple examples come to mind of how we've, I think maybe where we're going and how we're using some of this data. The first one is, just looking at real-time results and analysis. And so recently during a large PRRS elimination project, we were able to use PRRS processing fluid testing and oral swab testing in the farrowing house to manage our weekly on-farm elimination processes. And as you know, PRRS McRubble procedures are essential in reducing the spread of PRRS and farrowing, but adding real-time data allowed us to show the spread within a room or from room to room, and it helped us to reinforce those processes and get better results. So our farm managers were engaged in the process. They did a really excellent job of execution once they understood the dynamics of disease transmission. And so I'm really proud of that accomplishment. And we were able to get, PRRS eliminated with a lot of work and diagnostic data and rapid feedback to really fine tune those processes. So that's kind of the first real-time example that, I wanted to talk about. The other one, is a little bit more of a systems level. I'm a firm believer that data can be tremendously helpful in making health decisions. And like most of the industry, we started looking critically at our antibiotic usage and correlating that back to the health status of our sow farms. And it's not surprising that the use of therapeutic antibiotics in the nurseries are a result of PRRS and PED infections that set the pig up for bacterial challenges in the nursery. And so we're all concerned about the use of antibiotics and the need to make judicious decisions. But if we don't control the viral epidemics, we won't be able to make a long-standing impact on the industry by reducing the use of antibiotics. And so, your report talks about PRRS and PED and how they're impacting the industry. And I think, those are two key viral pathogens that we see really drive the antibiotic use in our nurseries, which, isn't really intuitive that they're viral, but they're driving the antibiotic use. But, our data would show that clearly. And, as an integrated system, we're able to use this type of data to help us make system decisions that are beneficial for the health of our herds, but that are also beneficial for our product marketing and consumer confidence on antibiotic use.
Mm-hmm. Yeah, that makes a lot of sense, right? As you said, may sound counterintuitive to say that viral infections drive antibiotic use, but looking at the interactions that the viral diseases have with the bacterial ones, that makes a lot of sense, right? Well, thank you. What are your final messages for our listeners regarding everything we discussed today, Tara?
Well, I want to thank you, Daniel, Giovanni, Edison, for your efforts and for the input that you're giving to our industry. Swine practitioners, we continue to use diagnostic data and really more and more for health decisions. And I think by adding technology for even more real-time decision-making gives us the ability to connect the production parameters with economics, with health, and that can even be more powerful. It's been really fun being part of your advisory group, and I look forward to where this type of reporting and information can take us in the future. So thanks again.
Thank you. Thank you very much.
Thank you.
Look forward to keep in touch with you. And thank you all for listening. We'll get back next month with the report 34.
Thank you.
Thank you.